with conservative management, we're going to test your urine. We want to make sure that you haven't got a urine infection. And again, we can get you to empty your bladder on something called a flow commode to measure your flow rate. And also, quite importantly, just a simple scan of your bladder to then just check you are emptying your bladder properly. There's always the risk that actually you've got the overactivity because the bladder's not emptying out properly. We'll spend a lot of time going through the bladder diary. We want to give you all the advice about your drinking. Are you drinking everything all in one go? Is that why you're emptying your bladder every hour? It's spreading your drinks out through the day, advice about caffeine, and also a bit of advice around things, you know, dietary things. If you have a lot of fruit juices, a lot of acidic things, that's potentially going to make that urine fairly acidic. And again, that's going to give you symptoms of overactivity. The bladder retraining, you know, we'll look at your bladder diary and we'll start from there, and we'll say, actually, when you get that urge to go, can you start by just holding on for 5 minutes every time? Can we then increase that to 10, 15 minutes to try and get your bladder to hold a better volume of urine? The pelvic floor exercises, they're key, and that doesn't matter if you've got overactivity symptoms, if you've got stress incontinence symptoms. Pelvic floor exercises for at least sort of 3 months to get hold, if you like, of your symptoms and get some improvement. We'll help to support you along with things like weight loss. Obviously, as Mr. Gupta said, if you're overweight, there's more pressure then onto that pelvic floor. And again, around stopping smoking being a real irritant to your bladder, particularly for overactivity. So looking at conservative management, as I say, when we've done all of the things on the previous slide, what we'll do is we'll either give you a telephone call at sort of a couple of months, we'll see you back in the clinic face to face, whatever works best for you. And if we've tried all of those conservative things for your overactivity and we're not really thinking things are getting any better, then there's the option of looking at something of medications. So there's 2 types of medications you can have for overactive bladder. The first is what are called anticholinergic. So they work on that bladder muscle to calm that bladder muscle down, so you don't get that urge as quickly, and it just gives you that time between getting that urge and getting to the toilet. There's a whole host of those: oxybutynin, solifenacin. They do have side effects. They can give you a very dry mouth, and that can be quite difficult to cope with, particularly because we're trying to manage your bladder. But sometimes just sticking with it, and the symptoms will start to improve. And medication can either be something that we ask your GP to prescribe, or if you've seen the consultants, they may prescribe that for you here. A different type of medication is something called mirabegron. And again, that still works on the bladder, but it works on the inside of the bladder. It's all about relaxing it down, so it's not picking up those signals as quickly. We do offer here something called tibial nerve stimulation. It's only available on a private basis. And that basically just works on having a little acupuncture needle in your ankle. And the tibial nerve runs sort of from your ankle all the way up to your spine, to the base of the spine, and it's involved in maintaining bladder function. It's a 12-week course, and again, it's not used that often, but it is always another option. If you're looking at the stress incontinence, if you're following the national guidelines, structured pelvic floor exercises for at least 3 months. And it's going to take 3 months to just wake that muscle up, to get it used to the fact it's supposed to be exercising. If you go to the gym, you're not going to be able to lift the big weights on week 1. So it's just building that up. And then we'll reassess you. We're your point of contact. We're here to help you all the way through.